right, once a month we have to check everything on the CT scanner and all of its parts to make sure everything is working properly, so we're getting the best possible images. So the first on our list that we need to check is table height indicator. So if we look at the display on the CT scanner, the very first number here is our table height indicator. So we can check, move the table up and down and see that those numbers are working properly. The number next to it is the table position indicator, and we'll check that off as well. Table goes in and out, the numbers change, so that's good. The next on our list is the angulation indicator, which is the next set of numbers. And we can rotate. So if we move the gantry back and forth, we can see that those change the different angles, so that's working properly. Next, we need to check our laser localization lights. So if we turn that on and come down here, these are our centering lights, so we can see that those are all working. And the next is high voltage cables and other cables. So what that is we just want to look along the floor and make sure that all of our cables are covered up, which they should be, but just do a quick look, make sure everything looks good, and no cables sticking out. And so the next item on our list is smoothness of the table. So as we move the table in and out, it moves very smoothly, so that's good. And the next would be our X-ray on indicator. If we were actually doing an X-ray right now, this screen would turn yellow, and it has been today, so I know that it's working properly. The next on our list is the control console. So we're gonna go look at that, and we'll go in here to the control room, check to make sure that everything on there is working properly. So the next on our list is the exposure switch, which is the yellow button here, and it has been working fine all day. It lights up when it's ready to be pushed, and it's been working great. The next, we want to check our display on our monitor to make sure that we can lighten and darken. So we're going to check that real quick, and we can, so that's great. Next is panel switches, lights, and such. So that is on here, and everything here has been working properly. Everything lights up when it needs to and works. And the next we need to look at is the X-ray on indicator. This will light up when the X-rays are in use, so that's been working fine today as well. The next we have is door interlocks, which we have set in our doors. When the doors are shut, the X-ray machine, or I'm sorry, the CT machine will work properly. If it's not shut, it will not work. So warning labels, we can see that we have a warning label here telling us that this is radiation high voltage, warning you not to just push that. We also have a stop button on here should something happen, we can stop quickly. The intercom system, that's on here as well. We can hear if we have this on, and we can talk to the patient if we have that on. So the next is postings and service records. So if we look here at the door, you can see that we have a sign on the door telling us that this is radiation, and over top of the door we can see a sign that lights up when the CAT scan is actually in use. And those have been working properly as well. Service records you can find on the intranet, under medical imaging, biomedical engineering is where all that is kept. So the next thing that we're going to look at is called a SMPTE pattern, and we want to pull that up so that we can take a look to make sure everything there looks good. So we'll just pull that onto our screen so we can see it. And the first thing on it says that you want to be able to see, there's two patches in there, and it's right here. You want to make sure you can see the gray box inside the black one, which is hard to see on here. And then you can see the gray inside the white there. And we want to make sure that all of our gray steps are visible, which is all the way around here. It starts white and gets a little darker as it goes all the way around to black, so we can see that clearly. The next, we want to make sure that our resolution patterns that we can see just fine, and that's here in the middle to make sure that we can distinguish between the black and white stripes. And then we want to make sure all the lines there are straight, and those all look good. And then we want to look at the gray level steps, which are over here on each side. It starts with the black and goes down to the white, and the other one is opposite of that. And that looks great. We can see all of those steps clearly. The next is alphanumerics. We want to make sure that we can see that. So down here it says quality control under a gray, a white, and a black. We want to make sure that we can read that, which we can. And then we want to look at our high contrast patterns, which are up here. You have a white and a black, and you can see them clearly, the difference in them. And there are low contrast patterns, which if you look here, you can see the high contrast black and white stripes, and then on the right, it's more of the gray. A little harder to see, but you can see the difference in colors. And the last thing we want to look at is to make sure that there aren't any lines or anything that looks odd on the image that shouldn't be there, and it looks really good. So that's it. That's all you have to do, and then you just record everything on the spreadsheet online.